Hello, Shane.
Hello, Rich. Hello, everyone. Thank you very much for joining us. It's lovely to be here. So no pressure. How does change really work? Well, I'm not going to pretend we've got all the answers, but we've certainly got some provocations. So I'm just going to very quickly take you through some of the things that we believe or have learned to be true about how change really works, and then use those as a provocation for Naomi and Matthew, and then hopefully for yourselves as we take this into the round. So, Rich, if you could just pop along. I guess important to say before we start to talk is why should you listen to me? There is an answer that exists to that, which is in the purview of my household. If you ask my children or partner and even the dog. But why Kaleidoscope? Well, I guess this is our work. This is what we exist to do as a not-for-profit management consultancy. Our job is to bring people together to improve and change health and care. And so we've been working in and around this for the last 7 years, and with again, with all humility, with some success. So as we're talking, just please do hold that in mind. We are very serious about what we do. A number of us have the privilege of being academics. I teach in healthcare leadership at UCL, and some of us even work in the health system on a part-time basis. So Rich is the chair of a healthcare provider. I'm the interim chair of a mental health care provider in South London. So some of this is a lived reality for us as well. Thank you, Rich. And so this, I think, is the most important picture you might see today, or indeed this week. This, for us, goes to the very heart of why change is so difficult. Because somewhere inside a room in London, a well-meaning, and possibly me in the past, someone will be telling the new Secretary of State for Health that change is and can be linear. And what will happen is at some point, the very real reality of how change actually happens or does not will come to bear. And this is really problematic. I think this idea of transformation or linear change is one of the most dangerous myths that we hold on to. All myths are false. Some of them are true, or some of them are helpful. And I think the transformation myth and the transformation trap is very real. I don't know if anyone recognizes the person who's not Wes Streeting there. Other people are available. This is one of my favorites. That is a gentleman called Ignaz Semmelweis, who in 1840 was the director of maternity at Vienna General Hospital in Austria. And Semmelweis was the first person to realize that particles of cadavers that his students were working on in the morning were infecting and killing women and children in very large numbers in the maternity clinic in the afternoon. And Semmelweis invited his colleagues to start washing their hands with chloroform. He knew nothing about germs. He just thought chloroform would be the best thing to take away the smell that came with those particles. And of course, maternity deaths fell off a cliff. Semmelweis, of course, then took this great idea, proven in evidence, to his professional peers and the system that he worked in, to no avail at all. In fact, he was rejected out of hand. He died 16 years later, at the age of 47, in an asylum for the clinically insane, driven mad into despair by the lack of adoption of this idea. Now, I tell that story because it's a salutary lesson. Let's hope Wes doesn't fall to that fate, of course. But it's not enough to have a good idea, even the very best ideas. So, thank you, Rich. So this is the primary challenge of leadership, which is that all change, system or organization or team is, and we cannot get away from this, it is individual behavior collectivized. This is the real work of change. It is taking a group of people through a process, a complex and timely process of understanding, motivation, capability development, opportunity, sustaining and improving. And if we allow ourselves to look past that, we are both going to be disappointed ourselves and we are going to disappoint those around us. Thank you, Rich. So what do we know? Well, we know why change fails. So this is our pre-mortem. This is based on academic research and literature. It builds on Kurt Lewin's unfreezing, changing and refreezing model. And I think this is important because if the majority of change does fail, as the literature suggests, then it's important to understand what that is. So we don't have to repeat these failures of the past. I will share this with you so you can make your own determination. But it's an interesting place to start because we know so much change fails. So how do we turn that into learning? But of course, it's not enough to know how change fails. That's necessary, but it's not sufficient. So what are the characteristics of change that works? So these are 6 that we believe are characteristics of successful change over time across cultures, across contexts. We have a little blog published in the HSJ about this on late last week. We'll share it with you. So just to bring a little bit of this to life in the context for our new Secretary of State, it meets people where they are. Structural reform is not what we need right now. What we need to do is to meet often very fatigued and cynical and exhausted leaders and professionals where they're at and understand what it is they need to facilitate change, and particularly figuring out how do we accelerate the integrated neighbourhood teams program so we can genuinely create a health and care system via integrated care systems where they can healthcare can meet people where they are very physically as well as metaphorically. It happens through real work and it prioritizes real progress today. There is a lure of grabbing for the transformation lever. We hope that doesn't happen. We hope there's a doubling down of the work that NHS Impact are doing. We hope there's a focus on sorting out Wi-Fi, sorting out toilets, which, by the way, have come up twice with client meetings that we've had recently. Please fix the toilets. Please do the Ted Lasso minute, a moment of turning on the hot water in the showers and making sure we've got the things that we need to do our job through. It is deliberate and planned. So how are we going to get 85,000 mental health care professionals safely and sustainably into our system? So if we think about, we've now doubled the proportion of nurses in the NHS over the last 5 years. But where we go, what we're seeing is there's a consequence to that. There is a drag on the experienced nurses who are providing support, learning, cover for that. There is also a risk aversion that creeps in, very naturally so, for nurses who are new to practice. And so we haven't thought about that as a systemic issue, simply more bodies. And we've known since the Mythical Man Month book in 1986 that that's not the way to go. We need to take a systemic approach to this. And then the curiosity and courage and being accountable, I think was very notable. That an act of courage, Matthew can talk about this or not, is a little bit too modest, just to go against the prevailing view, which is we didn't have enough managers if we wanted to turn around A&E at BHRUT. And actually, it's okay to say that. It's okay to say there is a role for a different approach in change that works. So just some provocations from us.